Hello, everyone. Welcome. Thank you all for joining us today for our exclusive webinar in honor of Mental Health Awareness Month. My name is Lane Scherer, she, hers, and I'm a program director with the Inclusive STEM Ecosystems for Equity and Diversity program at the American Association for the Advancement of Science. As your moderator, I can share that I'm a Korean American woman with black hair and glasses on. I'm wearing a black top and a printed bandana, and I'm coming to you from Washington, D.C. The issues that will be covered today are very dear to me as I began my journey navigating anxiety, depression, bipolar disorder, and ADHD during my time in higher education. And on behalf of our AAAS-ISEED initiative and the ISEED program here at large, I would like to welcome you to today's session with Daniel Eisenberg, Markie Pasternak, and Elizabeth Rohr. Before we jump into the workshop, I have a couple housekeeping notes. This webinar and presentation is being recorded. The recording will be made available in the coming weeks on our website, AAAS-ISEED.org, and you will also receive an email with a link to the recording when it's available. Additionally, we have closed captioning for this session. You can download and view the full transcript by clicking the CC button at the bottom of your screen. And as a little bit of backstory, for those of you who are new to AAAS-ISEED, this initiative seeks to support faculty, students, and the greater undergraduate STEM community by disseminating research and knowledge about STEM teaching, learning, equity, and institutional transformation. We invite you to learn more about the AAAS-ISEED initiative on our website and hope you will join our community as future contributors. You can follow us on X, formerly Twitter, at IU's program, and LinkedIn to stay up to date on our latest events, blogs, or to share what you learned at today's workshop. Before we shift it over to our presentations, please know that we've set aside time at the end of the session for questions, and you can feel free to share questions in the chat. We will try to get to as many of them as we can. And without further ado, I'd like to welcome Daniel Eisenberg, Professor of Health Policy and Management in the Fielding School of Public Health at the University of California, Los Angeles. Daniel, over to you.
Thanks so much, Lane. I'm going to share my slides now. Let's see. Okay, does that look okay? Great. So I'll spend about 15 minutes sharing some data, just a summary of data and evidence about student mental health in higher education, just to kind of give you an overview. And because I don't have a lot of time, I'll also point you to various reports and organizations where you could learn more about the data and the research on this topic. So as Lane mentioned, I'm at UCLA and I'm in health policy. And I spent most of my research career focusing on student mental health in higher education. And I am one of the leaders of the Healthy Minds Network, which started at University of Michigan, and now has many of us can spread around the country, working together to help bring data and evidence to practice in student mental health. My background is actually in economics, and so the way I like to think about this topic is how do we make the best investments? How do we make the best use of our limited resources and time to improve student mental health? And so that's sort of the guiding question for me and a lot of our research efforts. But to get to the answers to that question, of course, it's important to understand what's going on in the population and what's going on in higher education communities. So describing the situation using survey data, other sources of data, descriptive population data. And so that's a lot of what we've been doing with the Healthy Minds Network is collecting a lot of descriptive population data, but all with the hope of informing what this question of what are the best programs, what are the best investments to support student mental health, and trying to do all of this work in collaboration with practitioners, administrators, policymakers, and students themselves. The Healthy Minds study is our survey study. It's our main research project over the years, and it started at University of Michigan in 2005. It's an online survey that takes most students about 20 to 30 minutes to complete, and it covers a range of topics related to mental health. It has a handful of brief screens for mental health conditions like depression and anxiety. It's now been fielded at one point or another at many hundreds of colleges and universities around the country, and almost getting close to 1 million students cumulatively have completed the survey at some point over the years. At most institutions, it's a random sample. So like a large university like Michigan or UCLA, we would typically draw a random sample of something like 5,000 students. Um, and we've also fielded this survey at a small number of institutions in other countries, but I'm going to focus mostly on our US data. The topics of the survey, the core of the survey is mental health status, service use, and help seeking. But we do have, in this ring around the core topics, we have what we call our elective modules. And so each campus that participates in the survey can select typically one or two of these elective modules to complete the survey, depending on what topics they want to focus on. I'll show you a handful of data points, and then I'll tell you kind of where you could learn more. But as you probably have heard, the college populations, and when I say college populations, I'm talking about both undergraduate and graduate students collectively. These trends are largely the same for both groups. Um, College students have reported more and more psychological distress or symptoms of mental health conditions over the years. And so, for example, depressive symptoms, which we measure with the PHQ-9 screen, the percent of students with a positive screen, meaning that they exceed the cutoff of 10 points on the scale, has gone from around 20% of the student population about 10 years ago to now more like 40%. So approximately a doubling in the percentage of students who are reporting significant depressive symptoms. Similarly, anxiety symptoms, the percent of students with being at above the threshold has approximately doubled over the years. And similarly, also, the percent of students reporting serious thoughts of attempting suicide in the previous year has approximately doubled or even more than doubled over the years. So all of this, of course, is very concerning data. I will say, I think as terms of what's going on here, I do think probably part of what's going on is that students are more willing to acknowledge mental health symptoms. That there's clearly more comfort and awareness of the importance of mental health in today's cohort of students as compared to previous generations. So I think that's part of what's going on, but I also think based on kind of my collective read of the research that this does reflect also a true rise in distress. It's not just a change in reporting. And for example, we do see higher rates of suicide among young adults and adolescents today compared to 15 years ago. If you wanted to read more about these trends in the rise in distress among college students, this is an article that looks at our Healthy Minds data as well as the National College Health Assessment data and finds very similar trends there as well. On a more positive note, a lot more students are seeking help and receiving mental health care today than ever before. And so the percent of students who have had at least one visit for counseling or therapy in the previous year has almost tripled in the last 15 years or so. So now it's up around 37, 36% of students. That said, still the majority of students who have apparent needs for mental health support, the majority are still not receiving mental health care or therapy or counseling. So there's still a gap, even though for this large rise in service use and help seeking, there's still a large gap in the use of services as compared to the apparent need. And you all probably know college universities are struggling to keep up with the rising demand and have had trouble hiring enough counselors to meet the demand for services, especially particular times of year. When we look at what's going on, why are so many students still not receiving mental health care or receiving therapy when they probably would benefit? It does seem like a lot of what's going on is that students are not recognizing a significant enough issue there. So it's probably a part of it is problem recognition or perceived need. A lot of students in our survey say haven't had a need, even when they have high symptoms, or that they prefer to deal with issues on their own, or they don't have time. So if you want to read more about this rise in service use among college students, it's an article that our team wrote on that topic. When we look at what correlates, what are risk factors that correlate with mental health risk in college populations, probably won't be surprised to know that some of the main things we've seen are financial stress, as measured in our survey, difficulties with sleep, experiencing discrimination, experiencing abuse or assault. Those are all very highly correlated with with depression, anxiety, suicidal thoughts. Also, loneliness. Loneliness is a topic that we've been exploring in recent years. With the onset of the pandemic, we added a brief measure of loneliness to our survey, and it's a large percentage of students who are reporting different aspects of feeling lonely, and those students are much more likely to also report some of the mental health problems that I've talked about. So what do we do with all that? What are the data and research? How can the data and research help us address these challenges? One thing that I think has been helpful over the years is that some of our research looking at how depression among students predicts leaving college without graduating, so attrition from college, uh, that implies an economic case for investing in student mental health services and programs, because if we can reduce depressive symptoms, then we should be able to increase student persistence or retention, and that potentially has financial benefits to institutions as well as financial benefits to the students themselves, because they'll have more years of college education, potentially a college degree, and then the communities more generally will have more productive workforce, a more educated workforce. I had the pleasure of working with Lane and many others on a committee with the National Academies to produce this report here where you can see the cover. It's another, I think, useful reference if you want to just kind of get an overview of some of the research and data related to student mental health. So I wanted to highlight that here. And that report, here are some of the main themes that were discussed. I don't think I have time right now to go into these in any detail, but I'll just highlight, for example, um, number five on these themes, developing faculty, staff, and student capability to be of help. So what that's referring to is, for example, a lot of campuses, as you probably know, are trying to provide training and education to uh, particularly faculty and staff or student leaders maybe who are in frequent contact with a lot of students, so that the students have the ability, or so the trainees have the more ability to recognize students in distress and have supportive conversations with them. I think actually Markie is going to talk a little bit about that with some of the work with Active Minds along these lines. But that's one, I think, promising approach to help create more supportive communities for student mental health. Another important framework to know about, some of you probably have seen this, is that the framework that the JED Foundation and also the Suicide Prevention Resource Center has promoted. Um, the key here is that it's a holistic, it's a public health approach to student mental health that goes well beyond just focusing on mental health care. Like in public health, we always like to talk about the fact that healthcare is actually not, if you're thinking about what contributes to good health, healthcare actually contributes a pretty modest portion compared to all the other factors, the social and economic factors, for example, that are important for health. So a more holistic approach to student mental health would not just look at increasing mental health care and access to mental health care, but also would address basic needs like financial support, would promote social connectedness and belonging, would help develop coping skills, life skills, and so on. This is a report that I wrote with a couple of colleagues, Sarah Abelson and Sarah Ketchen-Lipson, recently in collaboration with American Council on Education. I just want to refer you to that if you wanted to see some of our research team's thoughts on how can we generally improve the link between evidence and research and practice and higher education. That's kind of going into more depth on that theme. It's a brief report. And And that brief report is also actually a kind of a distillation of a much longer chapter that we wrote for the Handbook of Higher Education, the Higher Education Handbook of Theory and Research, where we tried, this was led by Sarah Abelson, so I need to give her most of the credit as actually as part of her dissertation work. She's now at the Hope Center at Temple University. The idea here was to, and formerly at Active Minds, to review kind of the whole gamut of intervention strategies to support student mental health, strategies that go beyond clinical services. And so, for example, policies that support student mental health, prevention programs, group programs, peer programs, uh, and so much more, gatekeeper programs, and to really critically analyze, well, what does the evidence really say about what works best? So just to give you an example of one finding from this review, we found that some of the most effective interventions involve coping skills like mindfulness, as long as they have supervised practice. So basically, kind of more experiential ways of teaching coping skills seems to be effective in general, as compared to, for example, just purely telling people about coping skills. What's called psychoeducation seems to be less effective. The last bit I wanted to mention here is that we recently started a survey of faculty and staff as well in higher education. We've now fielded it at, I think, a few dozen colleges, universities, and a couple of the key, here I'm going to just focus on faculty, the findings on faculty specifically. Majority of faculty, almost 80%, report that they've had conversations in the past year with students about mental health. So they're having some contact around mental health. And that's probably not surprising considering that there's now this greater level of comfort, especially among students, in talking about mental health. But only about half of faculty say they have a good idea of how to recognize that a student is in distress, and that faculty have concerns like they don't want to make students uncomfortable. So they think someone else might be better suited to help. I might make things worse. So there's an interest, but also some discomfort and hesitation among faculty, if I would summarize it. And faculty, in terms of participation in these mental health trainings, most have not taken one. I was at Michigan for 16 years, then now I've been at UCLA for 4 years. I don't think I've ever really been asked to be part of a training related to student mental health, even though I've been at some wonderful institutions that are doing a lot for student mental health. So I think most faculty are not really being proactively asked to participate in trainings, but many of us are still doing some training out of our own initiative, perhaps. And most faculty who do so are finding it helpful. In the survey, faculty, most are saying that they would welcome additional professional development. They do want it to be short, online, self-paced. They also would like some of these things: list of mental health resources at their institutions, a checklist of things to consider regarding warning signs of distress, a reference guide about how to initiate a conversation, a suggested statement on mental health in the course syllabus. A lot of institutions are providing these things. You probably have done, many of you are probably doing this yourselves at your institutions. And then faculty themselves, of course, need support. We're people as well with mental health needs, and a significant portion of faculty are reporting depressive symptoms in our survey. And actually only 30% of faculty are saying they know what mental health resources are available at their institution. So I'm happy to follow up later on and also look forward to the discussion, but now I will turn it to our next presenter. Thank you.
Great, thank you, Daniel. Our next speaker is Markie Pasternak, the Senior Manager of Higher Education at Active Minds. Take it away.
Thank you so much. If everyone could just give me a moment to share my screen and get that up, that would be wonderful as we transition. Thank you. Awesome. Well, thanks for the handoff, both Lane and Daniel. I appreciate it. My name is Markie Pasternak. I use she, her pronouns. I'm the Senior Manager of Higher Education with Active Minds. And as Daniel so kindly referenced in his presentation, we work to mobilize students around mental health. So today I'm going to talk to you about what that looks like, how you can get involved on your own campuses, and also some resources that are available to anyone, even if you're not involved with Active Minds, that could be utilized by students, by staff at colleges and universities, and can help increase mental health literacy and understanding. And so with all of that said, what is Active Minds? If you've never heard of it or heard of us, Active Minds we are a large nonprofit out of Washington, D.C. that started about 21 years ago, and with the goal of mobilizing students around mental health advocacy and awareness. So we have chapters or organizations at over 600 colleges across the United States, and high schools as well, where students lead their own organizations and use the tools given to them by the Active Minds National Office from professionals like myself, and also create their own mental health advocacy events and policy initiatives, and kind of like Daniel was talking about, all these different interventions for mental health that are really key to making a mentally healthy campus. Our students are active leaders in that, and Active Minds gives them the sort of framework to organize under, an organization name to mobilize under. And we've, again, been around for 21 years now, which is amazing to think about. But how we really got started was in 2003, our founder, Allison Melman, was a college student at the time who lost her brother to suicide while he was a student at Columbia University and she was at the University of Pennsylvania. She noticed that a lot of the issue was the stigma around mental health, and how her brother, after reading journals that he had left behind, felt like he couldn't tell anybody what he was experiencing. And so she made it her mission to organize students to destigmatize mental health on their campuses and make sure students knew that it was okay to get help and what those resources were and looked like. And so what happens then is she starts the first chapter of Active Minds at the University of Pennsylvania. Her friend starts the second chapter at Georgetown University in Washington, D.C. And it's spread from there over, this past 21 years. So as I've alluded to before, Active Minds is this big organization, but we started as a chapter-based organization at different schools. And that's still probably one of our strongest programs that we house. So these chapters are led by students, just like other clubs on your campus, having a president, a vice president, a treasurer, a secretary, right? All those sorts of things. And the goal of the organization is to create a culture on your campus that is more supportive of mental health through, again, pushing for student mental health policy changes and working with your student government and your student affairs staff to make a more mentally healthy environment on campus, helping promote health services that have to do with mental health, whether it's a counseling center or any like trainings through health promotion, or maybe even promoting things at the rec center like mindfulness meditation or yoga classes, right? So promoting what's already going on in your campus on mental health. Building their own community-based events. A lot of chapters do that, whether it's a mental health awareness week, a stress less week. They're doing sorts of trainings and celebrating Mental Health Awareness Month, doing walks and fundraisers all around mobilizing around mental health. And then our Active Minds chapters also do awareness campaigns, whether it's for Suicide Prevention Month in September, Mental Health Awareness Month in May, Men's Mental Health Month in November, like all these different months we have around mental health and awareness days. You see a lot of our chapters go on social media or go throughout campus and really like amplify those awareness efforts as students. And I think the beauty of Active Minds, especially as a person who's, now a professional, but was in an Active Minds chapter myself 10 years ago when I was at my campus at Marquette University in Milwaukee, was that Active Minds as an organization allows the students to lead. The national office is here to empower the students and give them the tools and resources. We have a national conference in the summer that we invite our students to come to, where they can learn more about mental health advocacy and the best resources there are for advocates to get out on their campuses today. But ultimately, we give the power to the students. We don't tell the students what to do, what to promote, what to push. We more or less, again, give them the support and the framework. And then we help support the chapter advisors as well, who are usually faculty or staff on campus, who are invested in mental health in some capacity where we can help them support their students. But we do really believe in things being student-led and student-driven, and that is at the core of who we are as an organization. So that being said, when we think about our chapters, we want them to change norms on their campus. We want them to foster a community of peer-to-peer conversation, because we know from a research study that Active Minds did back in 2017 that peer-to-peer conversations and peer-to-peer advocacy works. We know that 67% of college students are more likely to first tell a friend that they're having a mental health issue than anyone else or a peer, somebody their age. And so knowing that we could leverage the power that Active Minds has as a peer-to-peer organization, that we're giving students the tools to communicate about mental health between themselves and get the resources that staff and faculty are providing to them in their peer networks. And so when we think about what Active Minds does and how we're setting them up, we want to foster all of these different efforts as a peer-to-peer led movement. So if you're interested in starting an Active Minds chapter, you're thinking, oh, this would be really cool at my school, I'm not sure if we have one. First, definitely go on our website and check out if your school is listed as a school with a chapter. Another easy way to do this, either again, use our website. A hack that I use to see if a chapter is active, besides going on our own, Salesforce stuff, is just going on Instagram and seeing if the chapter has an active Instagram and the last time they posted. That is a key to success right there. That's like kind of getting the tea, if you will, in who's active and who's not. But if you see that your campus doesn't have an active chapter, here's what you need to start one. You need at least 3 student leaders, and that's it, only 3 student leaders. You need 1 chapter advisor, so a faculty or staff member who's willing to supervise the student organization and act as the representative from campus. And then you need documentation that your chapter is officially recognized at your school. And so I do want to recognize that different schools have different requirements for student organizations to be started. Some of those have a lot more red tape than other institutions. But as the Active Minds National Office, because we know that schools have so many different processes when it comes to student orgs, we make sure to keep ours very simple. 3 students, 1 advisor, documentation from your school, and we will help you get anything you need required from your school to start being an organization. We have staff to help with that if you're interested in starting one. But here's just some examples of our chapters taking action around mental health. You'll see pictures of them at our conference, pictures of them tabling on campus and doing awareness campaigns. We have a promotion called Stress Less Week, where chapters mobilize before finals and have stress loss and wellness events for mental health available for students that are student-led. We've got different diversity and equity initiatives around mental health that a lot of students push in trying to get mental health to be talked about in different communities. And so it's really a beautiful thing what different campuses have taken Active Minds to do in their own communities, because we do believe that students know their own community best and what they need around mental health. And again, we're just here as staff to support them in getting the mental health changes and solutions they want to see implemented on their own campuses. So yeah, we have a ton of resources for our chapter and chapters, and these are just some of my personal favorites I wanted to put on a slide for you and briefly go over. We've got our Send Silence packing display, which is a display, I don't know if any of you have all seen it, it's pretty popular around campuses, but it's a suicide prevention and awareness display of 1,100, I can't talk today, backpacks that represent the average number of students who die by suicide per year on college campuses. And we have displays with education around suicide prevention that go to campuses, and our chapters put on this display. We've got our Calm tool, which is a tool you can find on our website that helps students navigate the mental health difficulties that can come from microaggressions and how to respond to somebody who commits a microaggression. And if you've committed one, how to kind of foster your own mental health in that moment to respond appropriately to the person, but also like not get defensive yourself. We have our new job website, Cause and Career, where if you're interested in a career in the mental health field, you can go on our website, Cause and Career, and look for job postings in the mental health field, not just in therapy, in public health and law, in policy, in a lot of different places you can find mental health. And then also get connected with professionals in our network who are willing to mentor you and talk to you about their career, which has been really awesome. We've got our speakers that you can hire at your campus, an array of speakers who dealt with mental health issues in college, ranging from different mental health disorders to mental health being an athlete, mental health being in Greek life, mental health being a student of color, mental health being a student with a physical disability. We have an array of speakers who talk about the intersection of mental health in their own college journey, who can come to your campus and talk or do a virtual presentation. And so those are just some of the things we offer, but you'll notice on the side, there's this big acronym called ASK. And that is actually one tool I wanted to show you today that we just released last week in partnership with MTV. And it's our new stop, drop, and roll of mental health, as we're calling it. So kind of some history behind this is that about 7 years ago, I want to say, some students at UCLA came up with the acronym VAR, standing for Validate, Appreciate, Refer. And it's an acronym for non-crisis situations in mental health conversations, when we know we have a lot of acronyms out there and trainings for students who are people who are in crisis, maybe going through a suicidal ideation phase or something like that. But students were wondering, what if a student's not in crisis? What if they're just really upset about a test that they failed, or, a roommate disagreement? Or what if they are experiencing depression, but they're not in crisis of some sort? They're just having a bad day. What do we do? So they came up with that acronym. And then this past year, we actually did some studies funded by MTV with different populations of students, including different students that identify as BIPOC, whether it's Black, Indigenous students. We did studies with LGBTQ plus students in different segments of that community, whether it was being someone's, sexuality or gender non-binary students. And we asked them, like, where does VAR feel inclusive to you, and where could it improve? And students then came up with ASK as the new acronym that they wanted to be out there. And so we launched this last week as like this new and improved version of VAR that is more encompassing of different steps that students might go through. So acknowledge stands for acknowledge, which stands for let them know their feelings, their experiences are valid, and that you believe them and recognize the courage it took them to come to you. Support is the S, that stands for show up and ask how you can help, offer options and resources for coping methods and or for professional help if needed. And finally, the K stands for keep in touch. This was a big change we made to the last acronym, and that is new and ask, is that actions speak louder than words, and just not having your check-ins be a one-time thing. Oh, I helped somebody, walk away, goodbye. Making sure you text them, making sure you call them, making sure you schedule a lunch or a get together, go to the gym together, right? Like do something afterwards to show that it wasn't performative and that you're genuinely caring for the person. And so with that, Daniel actually mentioned some research that we based some of this off of, where thinking about what kind of interventions work with students and what kinds don't. And there was some great research in the article he wrote with Sarah Abelson, who he mentioned about gatekeeper trainings and different things that work around education and mental health on campuses. So instead of making a gatekeeper training, which people think, oh, ASK is going to be a gatekeeper training. It's a, it's a 3-part acronym. You're going to learn how to do these 3 things. We're making it a little more untraditional. And it's actually an interactive YouTube video. So what you can do as a student is if you go on this QR code, and you want to try it out, I'll also show it in just a minute here. You go through these YouTube videos and you pick what the characters say to each other, and you can try out different things to see what the person's response is going to be if you were to say that. So if anyone remembers on Netflix a couple years ago, they came out with this like choose your own adventure series where you got to pick what happened to the characters you went through, and the outcomes would be different at the end. That's exactly what this is. So it's a YouTube video where you can get different outcomes in the end depending on how you're responding. So if we've got some time, looks like I got about 5 minutes, I believe. I'm gonna quick stop sharing my screen and show you all Ask, and get you to see this cool new tool that we have. Let's see. All right, making sure my sound is shared. All right. So does anyone in the chat want to say anything that you want Carly to pick? They should do. You seem stressed. You good? Need someone to talk? What's up? Want to chat? Oh, we have to go back because it's a very short window, so I can just pick for. Need someone to talk to. Thank you, Olivia. Appreciate it. All right, need someone. Oh gosh, it goes kind of again. It goes kind of fast. I'm only come on with it. So we want to chat, and let's see what happens. Different responses will get you different things. So let's say we don't want to obviously say cheer up, nothing to stress about, because that's invalidating. But if you click it, it's interesting to see what happens. You'll see that ask gently tells you why this might not be the best response. Let's redirect it a different way. it gives you a second chance to pick a better response, which is kind of neat. And so if you go through this tool, you'll see what different responses can kind of give when you ask. But I think what's neat about ask in the end is a lot of the responses that you can pick are ones that are kind of hard to pick the right one sometimes. You really have to emotionally, intelligently think about what you're going to say, because all of these don't seem bad right off the bat, but there is been found different validating and just encouraging responses to use, and you can learn those different ones by going through ask. So I would recommend you all try it out. There's also a website to go along with the entire tool where you can read more about different responses and how to talk to somebody who is experiencing a mental health issue of some sort. Again, that's not crisis related. So I'd encourage you to all check that out. I can put the link in the chat. And I hope you enjoy this new resource by Active Minds, and know that too, if you have questions about starting a chapter or anything else that we offer as an organization, that you can reach out. But with that, I'd love to pass it off to our final speaker. Thank you all.
Great, thank you, Markie. Our final speaker today is Elizabeth Rohr, the Wellbeing Advocate in the Rackham Graduate School at the University of Michigan. Take it away, Elizabeth.
Hi, everyone. Yes, bear with me, as everyone else. I need to share my screen here. So let's do this. Okay, slideshow. Okay. Okay. All right. So hi, everyone. And Markie, that was great. I'm always looking for different resources for students and faculty and staff at the university. So I will talk with you after about the ASK program. So anyway, my name is Elizabeth, and I am the Wellbeing Advocate. I use she, her pronouns, and I am a social worker by training, and I have been in this role now for just a couple years. I'll talk a little bit about what the Advocate program is, but also its history and the work that we've been doing, because this speaks directly to the question that I was asked, which is, what is Rackham? What is a graduate student or graduate student focused college and university doing to address issues of mental health and well-being with its students? So one moment. So just a little bit of history. It is the program itself, which I work directly with graduate programs. It is not a student-facing program, so we don't do student-facing program interventions. We're really looking at the kinds of systems and policies and structures that impact graduate student mental health. And this particular program came out of a few different things at Rackham. First of all, there was a growing awareness of the need to address graduate student mental health. And so in 2019, the school convened a mental health task force. And I apologize in advance for all the words. I didn't use a lot of pictures. But that task force created two sets of recommendations on how to better support institutionally graduate student mental health and well-being. And Dr. Eisenberg was a part of that task force and a part of the group that wrote the recommendations that ultimately created my role and the Advocate program. And in 2021, as recommended by the task force, a standing committee on mental health and well-being was created and was charged with implementing the task force recommendations, as well as developing additional resources that departments and graduate programs could use to promote student well-being. And at the same time, what was happening at the larger university level was the university joined the Okanagan Charter. For those of you who may not be familiar with the Okanagan Charter, it came out of the University of British Columbia, and it really gives universities and higher education institutions the kind of the ability and the framework to become health promoting in all areas. So that's either in the structural or programmatic curriculum levels. From sort of the top down, it really does kind of outline ways in which the university can better address the well-being needs of all of its constituencies. And so the University of Michigan joined the Okanagan Charter, and it pledged to a commitment to take holistic and a sustainable approach to becoming a health promoting university. And with that, created the Wellbeing Collective to help implement the charge of the charter. And so I mentioned that because my role and the work that I do is very similar to what the larger university is attempting to do, which is looking at, again, the structures and policies and systems that impact our students and also faculty and staff, impact their holistic well-being. All right. So again, a lot of words, so I'll go through this. There were some highlights to the task force recommendations. There were about 20, so I've only included 6 because I thought these were probably the most appropriate for this this presentation. But one of the big ones was to better understand, identify the interconnection of graduate program culture, expectations, and academic milestones and requirements with graduate student well-being. This includes things like addressing kind of toxic and corrosive cultures through departmental and graduate program specific interventions. And when I say toxic and corrosive cultures, sometimes those manifest through things like mentor-mentee relationships, kind of the culture in labs, in research, and things like that. The second was supporting and strengthening faculty-student mentoring and mentoring. It was meant to see mentee relationships by encouraging mentoring plans for everyone that really outlined everything about that relationship that was important and that could be impacted over the course of the time over the course of that relationship during the student's tenure at university. And so some of those early mentoring contracts really just outlined the number of hours folks would meet, what they might talk about. But the mentoring contracts now, or mentoring plans, really outline the relationship itself, the expectations that both the student and faculty have in terms of the kinds of dialogue that they have, what issues might arise, how many times that they'll meet, stuff like that. So that was a real departure. Well, how it exists now and how it did then was a real departure from the original mentoring-mentee relationship. And third was alternatively creating a meaningful safety net for students seeking to change advisors with minimal disruptions for the student, as well as bridge funding. This was an issue and an issue of well-being, both in financial well-being as well as mental health and the mental well-being for students. This came up repeatedly with students and still does, that if the relationship between a mentor and mentee or an advisor isn't working, and there are many sort of layers and structures in which a student needs to go through in order to change advisors, including having to talk to their current advisor about making that change. And so that was identified early on by the task force as a well-being issue for students and something that should be reviewed and changed. Fourth is developing new resources while strengthening existing ones for students, which include changing leave policies and shorter term leave policies. And I'll talk a little bit about sort of what's happening in this space at the end of the presentation. There was also utilizing existing Rackham resources. At Rackham, we have something that's called program review. It happens every 5 years. That means that every graduate program goes through a rather rigorous review by Rackham for a period of 6 months or so. And in that time, there are surveys and conversations and recommendations. And so in trying to identify ways in which programs could be asked programs could be asked about specific well-being issues, suggestions could be made. It was determined that program review might be the best, at least at the time, sort of the best avenue to do that. And so some of what has changed, and I'll talk a little bit about that at the end, are around well-being climate issues and student surveys, things that weren't happening initially. And finally, creating and funding dedicated well-being staff positions and programs, which did not exist within the graduate school at that time. And so that was a strong recommendation by the task force to fund a role and a program that would directly address student well-being. I'm going to drink some water here. Okay, and I got to keep an eye on time here. Okay, so the program was funded ultimately. Over the last 3 years, 3 to 4 years, all of the recommendations, all 20 of the recommendations in some form or another have been addressed. So again, I'll talk a little bit about some of the highlights of those at the end, but a big one was the funding of the Rackham Wellbeing Advocate staff position, which is mine, and then the Advocate program. And that launched in early 2021 with 2 pilot programs participating. Both were ironically in STEM fields. Rackham has 4 divisions that span the humanities to STEM. And so we had civil and environmental engineering and ecology and evolutionary biology participate. Again, these were graduate programs. And those 2 programs were very unique because they, again, one of the features of the Advocate program, and something I think that the task force was very concerned about, is that graduate programs themselves are unique. They're kind of unique ecosystems unto themselves. And so ensuring that whomever works with a graduate program understand that it has to be a partnership, that you're working with faculty, you're working with staff, and you're working with students. And so this was, again, civil and environmental engineering and ecology and evolutionary biology were unique because there were both STEM fields, and I think there was an assumption, even sort of at the Rackham School level, that both programs or both fields wouldn't be interested in addressing the well-being needs of their students, but they were. And so they were great first partners, and the partnership has continued with both into 2024. So just to quickly back up, my program, the work that I do, partners again with individual graduate programs, and through the work that we do, we empower graduate programs to identify and address common needs, stressors, and barriers that impact the multiple dimensions of graduate student mental health as they pursue their degrees. And really, I brought with me a social work lens and framework and how I describe this work as meeting people where they're at, not where you want them to be. And so a lot of the work that is done is really, again, about building relationships and understanding the unique challenges that exist within their graduate programs, which means understanding what the framework, the systems, the structures, the policies are in those programs. So graduate programs can engage with the Advocate program at a variety of levels, depending on the need and capacity. That was something that evolved over the first year. I saw a need for different levels of engagement. Graduate programs range from 20 students to 200 students. And so some have the capacity to do really deep, long work, like looking at their preliminary exams, and I'll talk a little bit about this in a moment, which is considered a major stressor for graduate students, at least in doctoral programs. So some can do that work, some have the capacity and to do that work, some do not. Some need more immediate fixes. I worked with a program very briefly that really saw a need to do away with timed exams. They had a very small number of graduate students, but saw how timed exams had impacted their students for 5 years. They'd kind of done sort of an anecdotal kind of like measurement of stress for these students. And so they really wanted to figure out how to quickly sort of transition from using a timed exam model to a non-timed exam model. So that was, as I started to work with these programs, I understood that, again, some people, again, wanted the deep work, some could not do it, or some people wanted the option of coming back later to do some more of that deep work. So I created 3 tracks. One, again, is working with a full team, which includes students, graduate students, and includes faculty and staff as well. Usually a couple different faculty members and a couple different staff members and graduate students. Usually we work together for 1 to 2 academic years, so it's a longer relationship. Track 2 is about focused advocacy. It's more ad hoc. So as you can see, 1 month to 1 academic term is usually how long they're with the program. And again, these are more sort of one-off, or at least more immediate needs that we can address, and then sort of with the option of doing some deeper work later. And track 3 is really for folks who, and departments or programs that just want information. They want access to resources and information, but don't want to commit to doing any sort of structural work. And so that is the faculty staff advocate. We usually will have 1 faculty member and or 1 staff advocate. And they attend our mental health and well-being committee meeting. I have individual meetings with them. But usually we talk usually monthly, just to make sure that they have all the information that they need to continue to meet the needs of their students. And by the way, usually the staff advocate in this role is a grad coordinator, so somebody who has lots of access and touch points with graduate students. So since 2022, my program has worked with 8 graduate programs across disciplines. So I've worked with women's studies programs to psychology currently, which is a program I'm working with. It's a big program, and it's a longer term commitment. And we've implemented a variety of program-specific interventions that address in one way or another barriers to student well-being. All right, oh, and coming up on time. All right, so these are some of the takeaways over the last, again, this program and my role really started in 2021. So we're in 2022, goodness. So we're really in 2024. So we're still a pretty young program, but these are things, some takeaways over the last couple of years and the work that I've been doing. There's tons and tons of research and data now to show that mental health and well-being resources and program interventions are key to graduate students. However, even with resources, an increase in resources and interventions, the mental health and well-being issues persist for graduate students. And what we're finding in new research is that, in large part, because the structural issues that exist in programs are really contributing to those outcomes. Faculty and staff need and want comprehensive training and empowerment. I think this was already addressed, and empowerment to better understand and support their students' well-being. And so that is something that the graduate program is working on too. But there's also lots and lots of resources that are starting to think about how to train and support faculty and staff. Through data collection, through the advocate program's own data collection, along with so much of the data that's available out there. There are several key program components across graduate programs and disciplines that have emerged or have been confirmed through this work. Some of those are preliminary and qualifying examinations, and these contribute to continued declines in graduate student mental health. So preliminary and qualifying examinations, which are most common, obviously, with doctoral students. Workload and work hours. This is present for both master's students as well as PhD students. Poor mentor-mentee relationships, a lack of or poor funding options, which is very specific to or particular to master's students, along with a high cost of living, but PhD students are not unaffected by this as well. Poor sense of belonging and inclusivity, as well as a lack of community building. This shows up over and over again in our underrepresented and marginalized communities. This was mentioned earlier too, loneliness and isolation. This pops up a lot with our PhD students post-preliminary and qualifying exams. And the process and requirements of obtaining accommodations. And this is a huge issue for graduate students, it's for undergraduate students as well, but for graduate students in particular, because they straddle a very sort of interesting space as both students and employees often. And there are more and more students who are seeking accommodations that are outside of what has always been understood to be a particular disability that can be accommodated. And so this is a big issue for the advocate program as well as the university as well. And the last thing I'll say really quickly, okay, we're at time, is defining. And one of the big things for this program that has really helped in the work that we've been able to do in sort of honing in on those things in a graduate program that are most impacting students is defining and operationalizing well-being as holistic and multidimensional. The university's framework or model of well-being has been really helpful in terms of my reframe or the program's reframe in identifying, assessing, and addressing issues of student well-being. And so that has been really, really helpful. And I can certainly, if people want these wordy slides, I can share them. And I can also share some links with folks. And how am I doing on time? Should I move on and let folks ask questions?
If you have like a couple more minutes and then we can move on to questions.
Okay, all right. Then I'll just do some quick wrap up. Okay. All right. So I'm kind of circling back to the mental health task force recommendation outcomes and some new initiatives that have emerged as well. So I mentioned that one of the recommendations was a more robust, comprehensive mentoring plan. And so over the last 3 years, Rackham has managed to now require, and I put that kind of in sort of light quote, because Rackham oversees probably about 160 graduate programs, but doesn't have the ability to make graduate programs do anything in particular, at least those that fall outside of, certain guidelines that are set by the university. So, but because there was so much evidence to suggest that a mentoring plan for graduate students, again, one that really spells out the relationship, how folks will interact with one another, what's considered appropriate language. These are what some of the mentoring plans look like now. So students have a lot more agency in determining the kind of relationship that they have with their faculty, mentor, or advisor. And so it's still relatively new, so the data is still coming in. But so far it has been successful when really employed throughout a graduate program. And this really covers mostly relationships between PhD students and their faculty advisors, or faculty mentors. So Rackham is also in the process of streamlining the request to change the advisor process, making it easier and less punitive in most cases, and financially costly for graduate students to request a new advisor. Because often what would happen if a student asks for a new advisor, there's the stress that comes with that ask, and that the student has to ask their current advisor directly. But then there's also the risk that you lose funding until you have found a new advisor. So this new policy will not only ensure that students don't need to ask their current supervisor or current advisor directly, but that they will also have gap funding available to them. Rackham is continuing to work on changes to leave and parental accommodation policies. One thing that has changed a lot in the world of graduate education are the types of students. And when I say types, I mean we see more student parents, we see more non-traditional parents or non-traditional students, we see caregivers. And so leave and accommodations are a really key component of student well-being now. And so Rackham is working to address that. Rackham is now looking critically at the Master's in International Student Experience. For a long time, a lot of the focus was on PhD students because they're with where they're with Rackham for a lot longer. But we're finding that master's and international student mental health has really been impacted by so many different factors in their own program experience. And so that is one of the things that we're looking at right now. And finally, Rackham is also in the process and experience of requesting and obtaining disability accommodations for students and student employees. And I'm sorry that that was written poorly, but again, accommodations are a huge issue for students, a huge well-being issue, mental health issue for students. And so it is finally part of Rackham's mandate to explore how to better support and streamline the process of requesting and obtaining disability accommodations for both academic and employment. And that is it. Thanks for giving me a couple extra minutes.
Thank you so much. We can now open up the floor to questions for the Q&A period. You can submit your questions in the chat feature, or you can come off mute and feel free to direct your question to one of the particular speakers, or if you have a more general question that you would like any of them to chime in on, you are welcome to do that as well. All right, Rita, go ahead.
Hi, thank you. This question is directed to Elizabeth Rohr. I was just curious about, are there, besides the Rackham program, is there a national mechanism, survey mechanism or repository for submitting and evaluating graduate student experiences? Or is is the Rackham program kind of an initiating effort towards that?
Yeah, I mean, there's lots of for graduate students, the graduate student experience, yes, I think it's a unique program. And I may be wrong about this, but as far as I know, it is not something that there isn't a larger sort of mechanism to as you asked, to report out on the graduate student experience.
Okay.
Yeah.
Is it primarily through just the institution itself if they have a program?
Yeah. Yeah.
Okay, great.
Yeah.
Thank you.
I will chime in, Rita, for some more information specifically on graduate student mental health and well-being. The Council of Graduate Schools a couple years ago put out a report, and I can share that in the chat. That might have some findings that are more particular to graduate students, if you know
yeah.
there. Yeah.
And there is Rackham is doing a new study, and the Council on Graduate Schools is as well. For 2024 or 5. Yeah.
So there's a question in the chat that says, I've heard that STEM students show higher rates of anxiety and depression. Is this something that you've seen? And if so, what factors might be contributing to this? Daniel, I'd be interested in particular if you've done research that breaks out anything by discipline.
Yeah, we've looked at differences by discipline. I think the first thing I'll say is that while there are some interesting differences across disciplines and across types of institutions for that matter, and even like across academic levels like grad student versus undergrad, I'd say more importantly, there's more similarities than differences. So in other words, pretty much every population within higher education has fairly high needs for mental health support, and also I think a lot of interest in this area. But that said, we've seen not so much higher anxiety or depression among STEM students, but I think we've seen somewhat lower help seeking or lower use of services among some of the sciences, and on the flip side, somewhat higher use of services in fields like the arts. Also kind of related to that, like when we look at liberal arts colleges, small schools, we tend to see higher use of mental health support than some of the larger universities. And also the one other thing I'll say is actually grad students overall have lower prevalence of mental health symptoms than undergrads. Even though grad school is very stressful and there's a lot of need for the kind of support that Elizabeth talked about, I think also there's the offsetting fact that grad students are a bit older and a little more settled in life, and that's a protective factor.
Great.
Is it okay if I say something?
Yeah, absolutely.
No, I appreciate the comment that Daniel just made, because I think that's part of what's become more clear about even with the advocate program is that it's not necessarily the mental health support that students are seeking. It is really, or seeking relief from, it's really the program, pieces of the program itself, which are impacting all of these other areas of well-being. So again, that's why things like funding and housing, social connection, loneliness, and these are things that come up over and over again with students, but which I was not expecting when I first started the role. So.
Well, I think to that point, Elizabeth, it goes back to that public health model that Daniel brought up
Right.
earlier. That's really, there's sort of the mental health services component, but so much of what impacts an individual is, sort of the broader context in which people are living and going to school in. So, other questions. So we have time for maybe one or two more, if there's any from the audience. If not, I might just ask then. Okay, great. Thank you. So in terms of sort of, you've shared a lot of resources, and some things that people can do in order to support students. If you were to, think about, what universities and colleges might do next. So it seems like there's this holistic approach that colleges are trying to operationalize and trying to make sure that the environment that students are in is more supportive of well-being. Do you think that there's what might we see next in terms of support for students? Is it more things that are sort of specific to particular, to graduate students? Is it more outreach? I suspect that we're not going to just, have an influx of counselors to address this issue. So I would love to hear sort of where you think colleges and universities might be spending their time going forward. And anyone can start with this one.
I can start. I'm excited about what Elizabeth described, and partly because I think, as she mentioned, I was on the committee for a while that I think led to some what she's working on. But generally, I think what's most important is to figure out how to sort of weave mental health, so a supportive environment into the entire kind of culture and infrastructure that students are a part of. And that's mostly, and so that has to involve the academic infrastructure. And so that's why I like that you've got faculty advocates, you've got departments getting involved in this, and like having ambassadors are kind of spreading it out throughout the community. And then I think also going to what Markie was talking about with the ASK program, it's a more continuous approach. It's not just a one-time thing that we do. It's not just an event that we do to support mental health or like one conversation. It's continuous throughout the student experience throughout the year. So I think kind of diffusing support all over the community and then also all over time is kind of the way that I like to think about it.
And kind of off of that too, I think what we've been seeing among the folks that we work with is really a want and need to address mental health in different communities, whether that be like BIPOC communities or LGBTQ plus communities. I think in light a lot too of different states putting in different legislation and things like that. We see a lot of people that we work with at different colleges and universities like wondering how they can support different types of students, and like recognizing that their mental health of these students can look different because of the different things they're subjected to throughout their life, and the barriers they have, and they have the largest gap in treatment and in resources. So how can we get those students the resources that they need, is I think a big question that we're seeing people wanting to answers to.
I think one of the best things that I've seen is, well, I think for, at least at the University of Michigan, is the Okanagan Charter, signing on to the Okanagan Charter, because it really kind of empowered and can empower departments and programs, across the university to look very holistically at well-being, and really start to think about the ways in which that shows up in just about everything that happens at a university, from the public transportation that's available to get there to the kinds of curriculum. It's just in everything. And so I think that when the university committed to the Okanagan Charter, they're really holding themselves accountable, I believe, to making those changes. And as I said, it empowers, like a school like Rackham to do the same. And so I think it's if anybody is in a higher educational institution that is thinking about different, more creative ways to kind of address some of these issues, looking at the Okanagan Charter as a possible avenue to kind of change the conversation from just sort of program interventions, but to, a much larger kind of transformation.
Great. Well, on that note, I would like to thank our three speakers today. Thank you so much. And as well as the rest of the AAAS-ISEED team and all of you who were able to join and participate today. We have a survey link, which we'll post in the chat and send via email. We would love if we could get your feedback. As mentioned, a recording of the presentation will be posted to the AAAS-IU's website, and we'll send an email about that in the coming days once it's up. But thank you all for joining us, and we look forward to engaging with you in the future. Take care.